Well, hello, everybody. Welcome again to our Start or Sit podcast. This is the podcast that we talk about the previous week's NFL injuries to maybe your fantasy football player, and will that player start or sit based on that injury. I'm Shannon O'Kelley, and he's Dr. Chris Hawkins, orthopedic surgeon, sports medicine specialist, and we're going to go through some injuries. Dr. Hawkins, how are you doing?
I'm doing great. We're getting ready for, the fall season, just like we talked about last week, and, getting excited. This combination of NFL and college football is a great time of year.
Yeah, big shout out to the Cougs this weekend taking on Oregon State. It's a good opportunity for my Washington State Cougs to kind of align themselves to maybe get picked up by some kind of a league or something like that, because we're down to the Pac-2, as you know. So let's go Cougs against Oregon State. Big game. This happens to be kind of the week 2 injuries, looking for week 3. I call this the week of the running back. And the first one out of the chute here, my gosh, what an injury. Nick Chubb, running back, Cleveland Browns. A lot of ligament talk here, a lot of torn ligament talk. He's out for the season, they're talking. This is an injury he sustained while at Georgia, I believe, in 2019 or something. So tell us what you think's going on with Nick Chubb, because he's out for the season, sounds like.
Yeah, it's obviously a devastating injury for the fantasy owners and for the real owners of this team. He clearly had an injury. They were real good on TV about kind of trying not to make it a gruesome thing, but everybody can go online and watch it. He had that foot planted directly on the ground, and a defender came right in on that knee, and his body just kept going over the top. So he really had what we like to consider a true probable knee dislocation. So, that term gets thrown around sometimes with lesser injuries, like when somebody pops their kneecap out of place, like Patrick Mahomes did a few years ago and came back real quick. A true knee dislocation is when the femur, the thigh bone, and the tibia, the leg bone underneath it, basically separate from each other and basically move greater than 50% off from where they should be. So, that can result in a fracture in some situations. In his case, that's usually indicative of at least 2, if not 3 of the main supporting ligaments in the knee being injured. And like you said, Shannon, he had a history from his time at Georgia where he had a 3 ligament injury and required surgery at the time. Obviously, he was able to come back from it, but this is going to be something that they're clearly going to need to do surgery for him. And it's probably a situation where at least 1, if not 2 of those cruciate ligaments, the main ligaments in the middle of the knee, and at least 1 of the side supporting or collateral ligaments has been injured.
Yeah, in our business, we call that a terrible triad. That's the 3 main ligaments that provide stability to that knee joint. This is the second time this knee has been injured. He's out for the season. At this point in time, I guess you and I both just want to wish Nick Chubb the best. I mean, he's a great athlete, and I think he's going to come back, but he's out for this season. So
yeah, one thing, Shannon, too, for the listeners to understand about this is one of those ones where they have to, they really have to take a close look at him quickly, too, because when you do have these knee dislocation injuries, sometimes you can actually have some secondary injuries to the actual blood vessel behind the knee. And so a lot of times these guys end up not just getting an MRI, but they get something called an arteriogram done where they put dye in because, you can potentially cause a clot in the artery in the leg afterwards. And, that can be, really limb threatening. Obviously, that did not occur. So they obviously checked into it and everything. But, again, that's why when you look at coverage at a game and you look at them getting out and looking at a guy quickly, getting him off the field, looking at, how his neurovascular status is, because, the nerves can get stretched as well with such a big injury.
Yeah, that's a really great point. I mean, I remember I had a hockey player that injured his wrist, fractured his radial, and the artery got caught in that fracture and pinched that artery off or damaged it. And they got in there and did surgery really quick on that, microsurgery on that artery to kind of repair that. So excellent point, Dr. Hawkins. Let's go on to David Montgomery, running back. Like I said, this seems to be the week of the running back. These guys take a lot of abuse. He's got that old typical, probably that thigh injury, contusion, and he is questionable to play in week 3. I think they have the Atlanta Falcons coming up. He was injured during the Seahawks game week 2. So David Montgomery, thigh injury, kind of maybe questionable.
Yeah, it's probably that exact situation where, a player, opposing player came in to tackle him, probably took a helmet into the thigh area, typically causes bleeding into the muscle. That restricts range of motion, restricts your ability to contract the muscle well, so you have weakness associated with it as well as decreased range of motion. So his recovery is really super dependent on the soft tissue healing, what his physical therapists, his athletic trainers do with him. He's a short yardage guy for them. They have Jahmyr Gibbs, their rookie running back, is kind of their bell cow running back now. And I think the expectation is that he will probably sit this week to get better, and they'll just rely on whoever their third string running back is to fill in for those short yardage situations and let him get better.
That's a good point. Yeah, what I read, he's most likely a sit this week going to week 3 against Atlanta. But that thigh contusion, when you talk about that contusion means exactly what you said, Dr. Hawkins. It's bleeding into that tissue. And that is very painful. And maybe talk about how it's important to kind of get that healing promoted and get that cleaned up. Let's talk about in athletes that myositis ossificans, that hardening of that tissue if you don't clean that blood up. Talk about myositis ossificans and these contusions.
Yeah, so that's a process that doesn't always occur, but it's always something you have to pay attention to. So again, if you get bleeding into the muscle itself, sometimes the way the body responds to that is, in a perfect world, the fluid gets absorbed and the muscle knits back together. But other times, the way the tissue tries to heal is unfortunately going through what we call like metaplasia, which is essentially you start to lay down tissue that is more like what you see when a fracture is healing. And so you can actually get calcium deposition into that injured tissue. And obviously that's not going to be as stretchy nor as, compliant. And unfortunately, if that occurs, that can be a scarring issue. That can be a real debilitating issue, and sometimes even need surgery if it's severe enough to actually excise that. If you have certain injuries where you expect that will occur, there's certain types of surgery and things where that's a concern afterwards. You can try to decrease the chance of that happening by being on certain anti-inflammatory medications, such as indomethacin. And even in some situations where there's a real high risk, they'll actually treat people with low-dose radiation to actually prevent that from occurring. But in a regular NFL player, I think they'll just keep a close eye on him. They'll do their best to mobilize the tissue and stuff like that.
Yeah, I just want to point that out because that can occur. I remember years ago I had an athlete that took a biceps contusion in the arm there and developed myositis ossificans, and he was a young man, so it was a concern for his future. But you want to keep an eye on that. So, again, it's biology. It takes time to heal. Here's another running back. Poor guy. Saquon Barkley, running back Giants, got hurt. They're calling it a typical ankle sprain. It's good news. It's not a high ankle sprain. But Saquon is pretty important to the Giants, and this ankle sprain, probably a grade 1 or 2. What do you think?
Yeah, that's the typical injury where, those low supporting ankle ligaments that are right between the lower part of the fibula, the small bone on the outside of your ankle, go to the side of your foot, so to like the calcaneus and the talus. And so typical inversion injury, not enough to split apart the two bones of the leg, which is where you get into the high ankle sprains where you injure what's called the syndesmosis. So he's as we've talked about, these guys that have to plant and cut and twist. He relies a lot on a good stable base to do it. And so with the short week, he's a do not play this week. They've already ruled him out for the game tonight. And I think he'll be back next week. So I don't think you have to, think long term about him, but and it doesn't look like any surgical issues, but they'll work on rehabbing him, get the perineal muscles, which are the muscles that cross the outside of the ankle, strong to really help control his ankle, work on taping him up, potentially bracing him for a few days in practice and get him back.
So he's do not play. He is a sit for tonight's game against the red hot San Francisco 49ers. They are looking really good. Here we go. Another running back for the Tampa Bay Buccaneers, who are looking pretty good in their own right. This is Chase Edmonds, and they're calling it a grade 2 MCL sprain. and he's out 4 to 6 weeks. Maybe talk about that grade 2. I know as an orthopedic surgeon, as a physical therapist, we like to grade things. This grade 2, maybe explain that, why that is a 4 to 6 week healing time.
Yeah, so grade 2, it's interesting. Sometimes radiologists will grade things based upon what it looks like picture-wise. For orthopedic surgeons, for MCL injuries, we go by the physical exam. So a grade 2 injury indicates that when we, put stress on that ligament, when the knee is completely straight, it feels relatively stable. But if we bend the knee a little bit, we get some give or some laxity of that ligament. So that tells us that ligament, which is somewhat akin to like a big piece of duct tape running down the inside half of your knee, if you imagine that duct tape peels off a little bit in the front from either the femur on the top or the tibia on the bottom. So the ligament hasn't ruptured completely, but in certain positions, there's some laxity to it. So that has to heal back. It's an extra articular ligament, so it's outside the knee joint. And so if you protect that for, 4 to 6 weeks, you brace it, you work on progressive range of motion, that duct tape, that ligament injury has that propensity to stick back down to the bone and have a good anatomic healing potential.
Yeah, so 4 to 6 weeks, it's biology. Again, we talk a lot about biology. I will say this, I know in my experience as a physical therapist, rehabbing athletes and athletes that have MCL tears, particularly grade 2, seems like if you get them back too early, because sometimes they start to feel good, that ligament is very sensitive and it can get re-aggravated and kind of prolong the healing time. So it's really a timing thing. Wouldn't you agree?
Yeah, absolutely. Absolutely. And that's why they usually, they'll, in his situation, if they feel it's loose, they'll just, they'll put him on IR. So they know, he's out at least 4. They'll probably reassess him. And that's why, if he's doing great, he'll be back at 4. But if he needs a little longer, they'll go to the full 6 weeks.
All right. Excellent. Austin Ekeler, running back, San Diego Chargers, has an ankle injury. It seems like it's one of these lingering injuries. He did not play week 2. He's questionable. I believe he is not practicing this week right now for up and coming week 3. Again, he's a fantasy football star, ankle injury, running back, San Diego Chargers, but not practicing. Boy, I tell you what do you think about Austin Ekeler?
Yeah, he's going to be, unfortunately, I think he's going to be our Darren Waller of this year. And, he's such a stud when he plays. But now that he has this sort of soft tissue injury, it doesn't seem bad enough to require surgery. I think he kind of goes by how he feels. And, he really hasn't had any meaningful playing time this year. And unfortunately, that makes it really hard to predict. Is he going to make it out? I think they literally probably ask him game day, does he feel like he's ready to go? And he says yes or no, and they just listen to him because they know, they trust him to say it. So I think I'd keep him as a player, but honestly, I think I'd still sit him until you see him come and play a game. You might lose out because he might come play that first game and get some great points for your fantasy team, but he's so risky. Unless you can make a decision at game time and you've got somebody to back him up, I would sit him this week.
I would agree. I think he's going to sit this week, and they're going to let him rest and get him back. The San Diego Chargers, I believe have they won a game yet? I believe they may be 0-2. So I think they would like to get him back soon because he is a producer. So here we go. Our final player for week 3, coming up to week 3 here. This is a quarterback. I think he may be the highest paid quarterback in the NFL, and he plays for Cincinnati, and everybody knows him as Big Joe Burrow. He's got this lingering calf injury, and based on what I saw at the end of the game last week, he was not very mobile. What do you think about Joe Burrow? Boy.
Yeah, so everybody I think saw issues with him in the preseason. He tried to sprint out of the pocket and just went down suddenly. So everybody got really worried that he had, what Aaron Rodgers ended up with, which was a true Achilles tendon rupture. But he was able to get up. They booted him for a couple weeks, sat him out through the remainder of preseason. So that's pretty consistent with the medial gastrocnemius injury, which is basically the inside half of the muscle that goes down to your Achilles tendon. That's usually a tear in the muscle. So go back to like that thigh injury with David Montgomery. It has to heal. The tissue isn't as compliant. And sometimes you feel great for everything until you try to push off really hard and sprint away from a defender. And then all of a sudden it hurts again because it tears on a small level, bleeds again, causes discomfort. So they're kind of like San Diego, where they're not performing where they should. He is a tough guy. I have a feeling he's going to try to gut it out. But, you know, he's never been a mobile quarterback, so it's not like you have to worry that he's Lamar Jackson and you need him to run around. So I think I would play him, but he has underperformed significantly so far this year, but he has the potential to break out and go really well.
Well, it looks to me like when I watch the game, it looks like he is having to be mobile because the pocket is collapsing on him. And to be mobile when you have a 289, 290, 300-pound lineman coming at you is pretty important. So you're thinking Joe Burrow is going to try to play, but keep an eye on him. Is that fair to say right now?
Yep, I think that's perfectly correct.
All right, there's week 2 coming into week 3. Those are our players. Stay tuned for next week. We'll review, again, the players that were injured and are they going to start or sit. I'm Shannon O'Kelley. He's Dr. Hawkins. And thank you for your time. Have a great day.